Good to go, JR? Well, good afternoon, everyone. Dr. Morrison will bring more updated information on some new positives cases in our province in a moment. I just wanted to start off with that yesterday we introduced some new circuit breaker measures. I know that it's not what everyone wanted to hear, but it's what is necessary to keep our province safe. And today we have to announce that we're going a little bit further to allow our teams at Health PEI and the Chief Public Health Office to test and trace to ensure we wrap our arms around these most recent outbreaks and to ensure we stop the spread of this virus as quickly as possible. More details to come, but we will be moving to a modified red or restricted on our alert system tonight at midnight for a period of 72 hours. I know that in the last 2 days there's tough news to hear, and these are 2 days in a row in which you're hearing it. But going into further restrictions is based on the growing number of cases, the number of close contacts, and the growing number of public exposures, which Dr. Morrison will expand upon in a moment. We both believe we need to move quickly in the next 3 days to get caught up on the contact tracing and testing and to do a targeted testing program over the next 3 days. Essentially what we have is 2 clusters of cases, one in Charlottetown and one in Summerside, that we've not been able to determine a link. And in both clusters, we have not been able to determine a source. So this is, as we have said for a number of days, cause for concern. And we are hoping the next few days will give us the time and data to help answer some of the many questions that we have and the many questions that you as Islanders have as well. As we said yesterday, we've learned a lot over the past 11 months and that it is quicker to go, harder, faster, and that will give us better outcomes in the end. As I said, I know these last few days things have been moving quickly and there's a lot of moments of worry. But we must remember to keep doing the things that are important. I want to, again, to every employee in PEI, I want to say to you, if you are sick, if you have symptoms, do not go to work, go get tested. We don't need work heroes. We need you to be careful, to do your part for our community and our province. Your absence at work may cause some minor disruption. I get that. But we are living in a period of disruption. Missing a day or two at work while you have symptoms and get tested is a heck of a lot less of a disruption than a circuit breaker or where we find ourselves in this province currently. We need your full attention and support to this. If you have any symptom, and I mean any symptom, stay home, go get tested. Also to employers, this is my plea to you. Encourage your employees to get tested if they are sick, if they have symptoms. Make sure they know that if they have symptoms, that it's okay for them not to be at work. If you need help in terms of support and resources from us as a government, let us know. We will be with you as we have been since day one. We would rather go harder and stronger now than wait for an outbreak like we have seen in other provinces that could put us in an extended period of lockdown for weeks or even months. That is not what we want in this province. The modified red level will mean different things for different sectors and different industries, and Dr. Morrison will go into further detail because we know there will be many questions in the days ahead. Just to state the obvious again, I know this is frustrating. It's frustrating for me, it's frustrating for Dr. Morrison, it's frustrating for every Islander. We are in a tougher spot right now than we have been for quite some time. But we've been in tough spots before. With hard work, with time, and with your continued support, we will get through this. Until we are able to confirm otherwise, we need to act as if this is the variant. And what we know is that the variants move and spread quickly, therefore we need to move quickly as well to do our best to get caught up. It is not our intention to be in a modified red any longer than is needed, and through increased and targeted testing, we will be able to better determine how widespread the virus is in this province, if at all. We've gotten here by supporting one another, being there for one another. That's been the hallmark of our response as Islanders. We need that more than ever. Right now, we have to take a pause. Let's allow our incredible staff who have been working around the clock to do what they do best. Let's allow them to test and to trace, and let's use that best information to guide us during this next 72 hours. So with that, Dr. Morrison, I will turn it over to you for more information.
Thank you, Premier. Good afternoon, and thank you for attending today's briefing as we provide an update not only on the COVID-19 outbreak, but as the Premier mentioned, information on additional short-term public health measures. Today, at this point, there are 5 new cases of COVID-19 for a total of 17 cases in the past 5 days. The 5 new cases include 2 males, both in their 20s, and 3 females, 2 in their 20s and 1 in her 50s. 3 of the new cases are linked to the outbreak in Charlottetown, meaning they are contacts of another positive case. 1 of the cases is linked to the outbreak in Summerside, and 1 case does not appear to be related to any other cases in PEI, but does have a history of travel outside of Atlantic Canada. All 18 of our active cases are now self-isolating and will be followed daily by public health. As a result of the spike in cases in PEI, we currently have over 190 people named as close contacts, with more expected. All close contacts have to self-isolate for 14 days following their last known contact with a positive case. And the list, as I mentioned, of close contacts continues to expand. To date, despite our best efforts, we have not been able to identify a travel connection with the cases associated with our current outbreak. Public health staff will continue to explore all potential connections to individuals who may have traveled out of the province. I remain concerned about the increasing number of cases in PEI and the fact that we have not been able to identify a link to travel. There may be more cases that will be identified in the coming days. As I mentioned yesterday, testing is the key to identifying how much COVID-19 is circulating in our province. Testing people both who have symptoms and those without symptoms is important in helping us to scope out what we are dealing with now and just how much of the virus is circulating in our province. And it is when we know the extent of the transmission of the virus that we will be able to really take the appropriate steps to curb the transmission of COVID-19 and to get ahead of this outbreak. Without widespread testing, we will be chasing this virus, and it will take longer to get it under control. So we are recommending that anyone with any symptoms of COVID-19 please be tested. And please check the website for a list of the locations and times for testing clinics across the province. But details of additional testing clinics today are as follows. Today, there is a clinic in Montague at the Legion from 5 p.m. till 8 p.m. The Slemon Park Testing Clinic is open until 8 p.m. The Three Oaks Clinic for youth in the Summerside area, aged 14 to 29, without symptoms of COVID-19, is open until 8 p.m. The Charlottetown Testing Clinic on Park Street is open until 8 p.m. Tomorrow, March 1st, there are expanded testing clinic hours across the province as follows. The Charlottetown Park Street Clinic is open from 8 a.m. till 8 p.m. The Montague Clinic is open from 8 a.m. to 6 p.m. And the Slemon Park Clinic in Summerside is open from 8 a.m. to 8 p.m. The Three Oaks Clinic will be open from 10 a.m. to 6 p.m. for people who do not have symptoms of COVID-19. And the O'Leary Clinic at the O'Leary Health Centre is also open tomorrow from 8 a.m. to 6 p.m. A clinic will be set up at Stratford Town Hall, again, for asymptomatic individuals. And I'd like to ask those young people aged 19 to 29 who are in the food service industry, who are in the meat and fish processing industry, any long-term care workers who are not vaccinated, anyone in that age group who are delivery drivers or public transit drivers or who work in call centers, all to be tested if they do not have symptoms at either the Stratford Town Hall Clinic in the next couple of days, as well as the Three Oaks Clinic. We would suggest that perhaps those in those categories who are between the ages of 19 and 24 go to be tested at one of those two clinics tomorrow on Monday, and those in the age group 25 to 29 go for testing at one of those two clinics on Tuesday. As you know, this weekend there was a targeted testing strategy for Summerside area youth aged 14 to 29 who did not have COVID-19 symptoms. And as of 3 o'clock, there were approximately 4,500 tests performed over the weekend across PEI. And that, of course, is not just at the Three Oaks Clinic, where they tested approximately 2,000 youth, but that includes testing across the province. I'd like to reiterate that youth who attend these clinics don't need to self-isolate until they receive a negative test unless they have symptoms. Thank you to the many young people in the Summerside area who attended this testing clinic. The response was fantastic. A sincere thanks to each and every one of you for being tested. And thank you to the parents, guardians, and caregivers who attended the clinic and with their children. Thank you as well to Health PEI, Island EMS, and the Provincial Lab, as well as Security, TIE, for their dedication and commitment to allow this testing to occur on relatively short notice. I have a number of additional public exposures related to the new cases to announce. Individuals who were at any of the following locations on the specified dates and times, and we are mentioning dates and times because I think it's important for people to know those details, should self-isolate and then be tested for COVID-19. Following their initial negative test, individuals do not need to continue self-isolating. However, they need to continue to be vigilant in monitoring themselves closely for symptoms and be tested if they develop any symptoms. The public notifications are as follows, and I mentioned two that came out in the press release last evening, but after we went to press. The Superstore in Montague, Wednesday, February 24th, between 4:30 and 5:30 p.m., and Thursday, February 25th, between 4:30 and 5:30 p.m. At the Tailgate Bar and Grill in Montague, Thursday, February 25th, between 9:30 and 11:30 p.m. February 15th, Domino's in Summerside, between 11 a.m. and 6 p.m. February 18th, Burger King in Summerside, between 8 p.m. and 9:30 p.m. February 20th, the City Bus number 1 in Charlottetown, between 4:30 and 5 p.m. February 22nd, Taste of India in Charlottetown, between 10:30 a.m. and 9 p.m. February 22nd, Superstore at 465 University Avenue in Charlottetown, between 6 p.m. and 9 p.m. February 24th, the Junco Market in Charlottetown, between 5 p.m. and 5:30 p.m. February 24th, Walmart in Charlottetown, between 5:30 and 6:30 p.m. February 24th, the Superstore at 465 University Avenue in Charlottetown, between 6:30 and 7 p.m. February 25th, the Taste of India in Charlottetown, between 11 a.m. and 10 p.m. February 25th, Christmas Discounters in Summerside, between 12 p.m. and 1 p.m. February 26th, Taste of India in Charlottetown, between 11 a.m. and 7 p.m. And February 27th, Walmart in Summerside, between 2 and 2:30 p.m. The previously announced public notifications are posted on the provincial website for many other locations, so please check the notifications, and if you are at any of these locations at the specified dates and times, please arrange to be tested. As I've said, COVID-19 is about balance. We need to protect the health of Islanders, especially our most vulnerable, and avoid overwhelming our healthcare system while ensuring the entire province functions safely. Achieving a comfortable and safe balance is much easier when our case counts are low and we know the origin of cases is related to out-of-province travel. Striking that balance is more challenging given our current situation. We are currently dealing with a serious and evolving outbreak of COVID-19. Community transmission is a possibility, and of course we remain concerned. Yesterday, we announced circuit breaker measures effective this morning at 8 a.m. for a 2-week period. At that time, I mentioned that if necessary, measures may be tightened to further interrupt the chain of transmission of COVID-19. And in order to limit the spread of COVID-19, we need to immediately focus on testing, contact tracing, and importantly, to limit movement of an interaction between people. We need to act quickly and efficiently to limit the transmission of COVID-19 and to contain the outbreak. As the Premier mentioned, effective at midnight tonight for a 3-day period, ending at midnight on Wednesday, we are instituting alert level red with modifications throughout the entire province. The following measures are in place for the 3-day period. No personal gatherings. Each household can associate with 2 individuals who are consistent for essential support. Individuals who live alone may associate with another household, and we should stay home as much as possible. No organized gatherings. Funerals can have no more than 10 people plus officiants. All recreational facilities are closed, including gyms, fitness facilities, bingo halls, casinos, museums, and libraries. No organized sports or recreational activities. Only essential businesses and services are permitted to be open to the public. Examples of services that can remain open to the public include medical and dental services, childcare, grocery stores, pharmacies, takeout and delivery of food, utility services, manufacturing, processing, transportation services, gas stations, banks and essential financial institutions, public safety services, and liquor stores. For essential retail services, operation at 50% of standard operating capacity is permitted, with monitoring of entrances and exits to ensure capacity is not exceeded. Anyone with questions about what is considered essential can email us at the Department of Health and Wellness. So it's depthw@gov.pe.ca, and that will also be included on the website and in the release. A phone number will be available tomorrow morning and will be posted on the website. Non-essential businesses, services, and organizations that are closed to the public may continue to operate by phone, virtual services, delivery, or pickup. For residents in long-term care, there are up to 3 partners in care and a limited number of visitors are permitted. And schools, post-secondary institutions, and training programs across the province will be closed during this period of time. As mentioned above, child care centers will continue to be open, and parents may contact their child care centers for further direction. I'm going to repeat something I mentioned yesterday in relation to what you can do to help us. If you're a business or organization and required to keep records of names and contact information for patrons, attendees, or staff, please ensure these records are accurate, complete, easy to read, and readily accessible. Secondly, individual islanders can help to contain the spread of COVID-19 by respecting the public health measures put in place. We need to keep our circle of contacts small, keep 6 feet away from people outside our household, wash our hands often, wear a mask in public places, stay home from work if we're not feeling well, and avoid non-essential travel. Lastly, if you have any symptoms of COVID-19, please arrange to be tested and isolate until your results come back. As we've said in the past, we will get this situation under control, and the Premier said it as well. We will get through this. Our focus will continue to be on containing the spread of this virus, self-isolation, early identification of cases, contact tracing and quarantine of cases and their close contacts. We will be completing comprehensive contact tracing of all our cases. So as we strengthen our efforts to limit further spread of COVID-19 in our beautiful province, please continue to be patient and continue to be kind. Thank you.
Thank you, Dr. Morrison. So we will now turn it over to some questions from our friends in the media.
Nicola McLeod, CBC.
Hi, this question I guess is for Premier King. Premier, will the government be introducing any funding for businesses or individuals who will be unable to work due to what's going to be occurring over the next few days?
Yeah, thank you, Nicola, for the question. So, I mean, when we began looking at what this could look like, I mean, obviously it's been all hands on deck here all day. I've asked Minister McKay and his staff to be working on essentially just that, to be reaching out to determine what the need is, and for us to be there with our programming, with our finances, to help island businesses and islanders through this, which we hope will be a short period of time. I mean, we've been working with education staff, Minister Jameson and her staff, to be prepared for the next few days. So it's really been an all hands on deck. I mean, and health, of course. It's been all hands on deck. But yes, I mean, we've been there from the beginning for each and every islander to the full extent that we can be, and that will continue through this next 72-hour period of time.
Great, thank you. And for Dr. Morrison, this asymptomatic testing campaign has been going on over the course of the weekend. Can you tell us if any of the positive cases turned up in that asymptomatic testing campaign?
I do not believe any of the positive cases have turned up in the asymptomatic testing. As I mentioned, they have been linked. The new cases, for instance, today, the majority of them are linked to previous cases, so they have been, even if they did not have symptoms, they have been tested as a result of us asking for that testing.
And you had mentioned one case who had been linked to travel outside of the region. Was that person in self-isolation?
So they arrived recently back in the province, so they went almost immediately for testing. And so, remained in isolation until the test results came back, from my understanding. But that is a relatively new case that Public Health Nursing is following up today.
Thank you.
Laurent Rigaud, La Voix.
Good afternoon to you both. Dr Morrison, bonjour. Est-ce que vous pouvez nous expliquer en français pourquoi vous décidez d'aller tout de suite plus fort sans attendre le circuit breaker, enfin les effets du circuit breaker que vous avez mis en place ce matin?
Oui, bonjour Laurent. Alors, c'est une bonne question. Et puis, je pense que ça suit vraiment de ce qu'on dit, pas seulement hier, mais même en décembre. Il faut aller assez fort, assez vite. Et puis, on sait qu'on a beaucoup de personnes quand même. On veut faire tester. On a de plus en plus de public exposure notifications. On a de plus en plus de personnes qui sont les contacts, qui sont proches. Et puis, on a encore des cas. Alors, on veut vraiment s'assurer qu'on fait tout ce qu'on peut pendant les prochains quelques jours, 72 heures, pour augmenter les tests, de s'assurer qu'on peut faire tous les contacts qu'on doit faire et pour voir vraiment si on a plus de transmission ici à l'île du Prince-Édouard et on veut faire ça seulement pour les 3 jours et j'espère que ça va juste avoir vraiment une pause pour tous les insulaires pour s'assurer que ça ne transmette pas plus loin.
Merci. Et juste une question sur ce qui ferme pendant ces 3 jours au niveau scolaire. Est-ce que ce sont toutes les écoles ou seulement les high schools? J'ai pas compris.
C'est toutes les écoles, de maternelle jusqu'à 12e année.
Merci beaucoup.
Okay. I'll just translate at least part of that, just clarification on the closure of schools. It's for kindergarten to grade 12, so all schools. The question was really around why do this 72-hour more sort of increased measures as opposed to waiting longer. And sort of as a continuation of what we've said before, it's better to go harder and faster for a shorter period of time. And when we still have people we want to be testing, we want to enhance that testing. We have increasing numbers of public exposures. We have increasing numbers of close contacts. And we want to do the follow-up that we can, and we still have no known source. So we are trying to make sure that we do the best we can in the next couple of days to limit any further transmission in this province.
Wayne Thibodeau, CBC.
Good afternoon, Premier King and Dr. Heather Morrison, and thanks so much for doing this for us on a Sunday. Premier, I wonder if I could just direct this first question to you. You had a very passionate plea both to workers and to employers about the steps they need to take to protect this province. Should we read into that some of these cases may be connected to employers or employees not following the rules?
Well, I'll certainly let Dr. Morrison deal with the questions as to individual cases. I just think that, when we are on here to the extent that we are, Dr. Morrison's here a lot more than I am, thankfully, but we are continually trying to remind people not to let your guard down. We can see the finish line, but that doesn't mean we need to stop or relax. And we do hear from time to time that so-and-so was at work and they weren't feeling well for a few days, but they decided to go to work. And as we get through to almost a year of this, and being able to see the finish line, it's frustrating sometimes to hear that. I know it frustrates Islanders certainly to hear that. And I just want to, reiterate to employees that it's okay not to go to work. And I need every employer to continue to do what they've been doing by telling those employees it's okay if they don't go to work. Now, I know this causes disruption. I know that. But it's a minor disruption compared to what we're looking at in the big picture right now across the board. So I just wanted to use my time tonight to remind all of those to not let our guard down. Let's not stop doing what we've been doing. Because it's worked, and nobody knowingly brings COVID home into the province or to the workplace. But there are things we need to be mindful of, and we just don't want anyone to drop the ball at this point. So that's why I raised it tonight.
Dr. Morrison, do you want to pick up on that as well?
I mean, I think I would echo the Premier's comments, and I think we've said all the way along, and I think particularly in otherwise young, healthy people, sometimes the symptoms are mild, and they may not think it's worth missing work for or going to get tested. So it's really trying to emphasize how important that is, and also for employees to make sure they have a process in place to screen their employees to make sure they're well and support them if they need to go get tested.
And can we also clarify what's happening with schools? I know you said schools are closed for the next 3 days. So are we moving to online learning? Are we just simply shut down at the K-12 and the Holland College and UPEI? What is the situation specifically over the next 3 days?
So I think, Wayne, Holland College and UPEI will continue. They've been doing a lot of online learning as well. Right now, from a K-12 perspective, I know education staff will be talking with teachers and assistants to use the next couple of days to prepare if we need to extend beyond this. But right now, it's just it's a 72-hour shutdown at this point. And they will use the time to get ready if we need to extend this, which we hope we don't. The other part that education is dealing with is that Friday is scheduled for parent-teacher interviews, and they will be working over the next couple of days to make sure that is undertaken virtually or by telephone. It won't be in person due to the circuit break that we're in.
Thank you both very much for your time.
Thank you.
Logan McLean, The Guardian.
Good afternoon. Question for Dr. Morrison. Yesterday, and today actually you mentioned that those who keep contact tracing records, businesses and organizations, they should ensure that their records are complete, accessible, easy to read. Have been people, I guess, is there a certain standard for record keeping, and has there been an issue with people not meeting that standard?
Logan, thank you for the question. And I think when we have been in the process over the last few days of reaching out to so many different types of businesses and organizations, and we've seen this before, that sometimes the lists may not have up-to-date phone numbers, contact information, and it's really helpful for us, and we really need that information to be as accurate and timely as possible so that then we can reach out to them and make sure they're tested and are isolating. And really critical if we're trying to think about any, if we end up dealing with a variant. So it's, I think it's just a reminder. I think most places are doing it, but it's to make sure that it's in a format that we can be comfortable and confident in and be able to receive as quickly as possible so we can help them reach out to people we need to.
And what's done for enforcement around that? Is it checked on, or is it sort of an honor system situation?
Well, I mean, it's part of the operational plans for all the businesses and organizations. We actually have also added it to the public health order to make sure that it's clear that it needs to be provided to us in that way in just a few hours.
Great, thank you.
Okay, you're welcome.
Brett Bundell, Canadian Press.
Yeah, thank you for taking my question. I'm wondering, this was touched on, but I'm wondering if you can elaborate on what you would need to do or to know before this would be deemed community spread. Like, is this considered community spread, or what is the threshold to sort of declare that there is community spread within or on the island?
Hi, and this question was, we just had a conversation before coming about this exact, the terminology of community transmission. At this point in time, we obviously we have two clusters of cases that are, are in our community, and we do not have a source. However, they all appear to be linked to each other. We are not seeing widespread community transmission at this point in time, and so that's why, in many ways, it's so important for us to continue to do this testing that we're doing, make sure we can get our arms around these clusters of cases, and make sure it has not spread into any kind of widespread community transmission. So it's concerning for it, but I would not say at this point we have widespread community transmission.
And just one follow-up. I know the Premier had mentioned that, this is a chance to kind of get caught up on testing and to do the contact tracing, but I'm wondering, if the cases, if you continue to see new cases daily, is there a chance that this sort of lockdown could be extended? Or I guess what are the parameters that might come into play to sort of see an extension of that?
Well, I mean, the Premier may want to comment as well. I think certainly if we start to see more cases particularly that are not linked to these clusters, if we that would be the biggest concern, more cases, and that we really feel like we are not able to manage the outbreak that is currently underway here. So that may extend it. I really hope that's not the case. I would anticipate that we will have a lot more information in the next couple of days, and then we'll ease out into more of our our other circuit breaker measures over the following week. And so that is what I'm hopeful for. And it's not to say we will not get more COVID cases after the 72 hours, but it really will be we'll be going into that next period of time more informed about our prevalence in our community, and particularly in an age group that we have where a lot of cases have been identified.
And Brett, I just sort of add to that the one constant and consistent throughout our approach here is that we need to look at this every day and sort of reevaluate where we are based on the information that we have. It's not our intention to be in this situation any longer than we need to be. We want to use the time to get the best information to guide our research. And I know that, we ask ourselves the question all the time is this an overreach? And our answer is, gosh, I hope so. I really hope so, because that means that the caseload will be more controlled in a few days, and we will be in a better place to move forward. But, we've tried our very best throughout this to go as hard and fast as we can to try to get through it more quickly. And it's a step we never want to take. After having done, so well for so long, it even probably stings a little bit for both Dr. Morrison and I and all Islanders to need to do this. But I really do think this pause for a few days will be good for all of us. It will allow us to do some testing and tracing that we need, and really, really hope that we can be out of it quickly. So, sorry, go ahead, Brett.
Sorry, one last final
Sure.
question. Do you anticipate any changes that sort of being reflected at the border, like at your land border? Like, will there be any different sort of guidance given for either essential workers or people who are returning to the island?
Hi. We actually have discussed that even with our team in public health, and we have very, I think, fairly strict border measures that are in place. We are going to make sure that we continue to look at our testing regimens of anyone coming in and out of or coming into the province and following up. We have, that's something that I think has been one of our strengths in the last 11 months in terms of our border measures. So they will stay in place, but we'll just continue to monitor and make sure that the testing regimens are followed.
Thank you.
You're welcome.
Well, thank you, everyone, and to all of those who are working today in the media. I know it's Sunday, and just thank you for continuing to help Islanders better understand where we're at, and for sharing that, allowing us to share our message through your platform. So thanks for that, and stay safe.